memorize this. Is that cool? So we went over all these except for a difference between, so we'll do that right now. Okay, so you have HIV and you have AIDS. So AIDS people are HIV positive, and when their count, let's see, when their CD4 count, so like their immune system, is less than 200, that is when they're classified as having AIDS. Or they get an HIV infection, so those kind of ones we went over, or HIV-related cancer. So Kaposi sarcoma, HIV cancer. So that's kind of what classifies you.
Okay, so CD4 lower than
200. And that's the most
and what is CD4?
That is part of your immune system. So that's why if they're below 200, that kind of means like you're really
very low.
Yeah.
And then HIV or.
Okay. Let me see. That's like the criteria. She has a table. Okay.
Well, would HIV just be the pre-stages? I mean, is it like?
So, yeah, basically. So if it gets worse, they're going to get AIDS. So, an example of HIV infection, these would be pneumocytitis. I can't say that.
Is that the TB and the pulmonary
stuff? That's the PCP.
And all that.
Yeah, she only put a few on her slide, so maybe just know these ones. If they get TB, so if they have HIV and they get TB, then they're AIDS. Toxoplasma, gone. D.
Yeah, I see them on there. It's the pulmonary and that one and TB.
Okay. I see this for a second. I feel like most of them are going to be on like how you are as a nurse and how you're going to treat the patient. So a lot of therapeutic things.
Infection.
Don't treat them differently.
Yeah, exactly. Like things like
So
that. Things that really apply to us.
Probably stuff that we could figure out by reading this stupid question.
Okay.
Yeah.
Sorry.
No, you're.
I wish I knew, but you know.
Okay.
So HIV, so that would just be the pre. I mean, there's nothing that you're finding slide-wise on that.
Precursor.
It's the
I guess it just counts above, like CD4 counts are greater than 200, but you still got the antibodies.
Let's see if I can find a better definition.
What did you say? I'm sorry.
That your CD4 count would be above 200, but like.
Yeah, that's probably true.
You've got the antibodies present, like you test positive for it.
But you still have antibodies for. Holy cow, girl! How'd you?
Did you hear that?
Yeah, I did.
Gross. Let's see. Okay, so HIV is just when they have low CD4 cells, right? And so this is definitely.
Yeah, but that's what.
But not. It has to be above 200 still. So if their CD4 is
Also low, but above 200.
Yeah, and so then once you get like yours attacks your immune system enough, then you get to AIDS, or you get infection or a cancer starts thriving in you. Then you get AIDS.
So maybe it's just that level that's the big ticket.
That's really what it is. So remember 200. Okay. So do you guys want to start moving up, or?
Have you gone over any of the study guide?
No.
Well, we could start on 17. Do you want to start on 17? That's where we got to.
Okay. So
kind
what
of discuss
is
some of those.
17? Sorry, actually I can pull it up.
Here, right here.
I can pull it up quick, I think.
Because you can
Combined
look.
electrolytes, is that pretty much what we went over?
It's this test, I think, the test that you just
Probably.
did.
Does she have the study guide? It's not under lesson 10.
You can just look at this. It's totally fine. So we're 17, which is
fluid electrolytes. So fluid volume excess, what does that look like in the patient?
really good.
This is fresh in your brain still, right? So you have
Should be
edema.
really fresh. I don't know when I took mine. I don't remember what day.
You haven't taken it yet?
Yeah, I have, but I don't remember what day.
Oh, come on. Sorry.
It's all together. Maybe
Yeah,
it's
so-
Tuesday, I don't know. Okay,
So-
so that would be edema.
Mm-hmm. What would their...
That's when they have
blood
heart
pressure
problems and stuff like that, right? Because the fluid is high.
be? Yep,
So-
congestive heart failure. High blood pressure because they have lots of volume in there. You could hear some crackles in their lungs. JVD, that would be present. Their pulse would be bounding, right? Polyuria. The urine would be light colored. Let's see what else. I think, yeah, edema is the huge one too. Did you put that down?
Okay, I just don't know what she's gonna.
Like,
What's the
This is
other?
the
Okay,
basics.
fluid volume X and then deficit.
So deficit's like dehydration.
dehydration. So what would the hematocrit be for fluid volume excess?
Low.
Low, yeah. Hematocrit for fluid volume deficit? Mm-hmm. So dehydration?
So just on hematocrit's high on deficit and low on.
Yes.
Did I say that right? Yes.
Yep. So dehydration, they're gonna have sunken in eyelids.
Yeah.
Their blood pressure is gonna be weak. It's gonna be lower. Their pulse is gonna be weak. What else? You guys just took this test. So this will be me testing you.
I think that's about.
There's tons.
Dry mucous membranes.
Yeah, dry mouth, dry
Mhm.
skin, confusion, turgor.
What would a trigger be?
Like rotary turgor.
Would be tented.
Mm-hmm.
That kind of stuff. I think that's one of the easier ones to.
Yeah.
What else has you got? Signs and symptoms, we know that interventions, that would just be giving more water and that kind of stuff. Potassium imbalance, maybe we can go through that.
Okay.